With sky-high temperatures across the metro Atlanta area, a good part of the United States, health experts are issuing urgent warnings about the dangers of extreme heat posed to older adults. Here now is Dr. Anup Sharma, and he is the Chief Medical Officer with the UnitedHealthcare. Welcome to the show.
Thank you for having me.
All right, Doc, talk to us about why older adults are so much vulnerable to extreme heat than younger adults.
So as we age, we tend to not have as many ways to regulate our bodies. Plus, some of the medications we're taking will have a direct impact. Blood pressure medications, sometimes the diuretics, the water pills, they'll have an impact on our ability to really control our amount of volume we have in our bodies, but also our general ability to respond to heat.
Now, I remember my mother, all right, saying that, she used to be outside all day, working in the heat, that kind of thing. Are we seeing more heat-related cases with older patients now than we have in years past?
Absolutely, because more and more patients are, of course, wanting to be outside, but as you know, the amount of warmer days we're having year over year has increased drastically, including from a study from UCLA where 2025 is meant to be one of the hottest years ever.
Yeah, temperature's getting warmer. So what are some of the early signs or warning signs that we would see in seniors as they start to overheat?
So initially, you're going to see a lot of sweating. You're going to feel thirsty. You can also feel a little lightheaded, but you're still sweating. It's more when we stop sweating, that's when we get concerned.
Mm-hmm. Are there more chronic conditions that make heat exposure more dangerous for older adults?
Well, if you've got high blood pressure, if you are taking certain medications, yes, it makes it more dangerous for patients. But also remember, we tell patients that are on diuretics or other medications not to drink a lot, which of course during the summer months makes it worse for them.
Yeah.
And of course, heart failure is one of the other illnesses that causes us to say that, but dire consequences otherwise.
So you mentioned those other illnesses associated with the heat. Does it have an effect on some of the medications as well?
Yeah, well, the fact that normally we're giving a water pill to make sure we have a certain amount of volume going to the heart, which doesn't make it work so hard. Now imagine in the summer months where now the patient is adhering to our guidelines, but now they're losing more water in the heat. So now they technically need it, but they're hesitant. So that'll have a drastic impact on them and causing more challenges that cause them to wind up in the hospital or other places.
Yeah. What's your advice to caregivers or neighbors who need to check in on our elderly neighbors?
Make sure that they've got the resources they need. Help them pick up their medications so they're avoiding the worst times to be outside between 10 and 4. Also, if there are any cooling areas for them, like a community center or even from like the mall, you can also utilize that. But just frequent checks on them. That's the winning opportunity.
What if they don't have air conditioning? They only have a fan in the house. Did we just move them out, try to get them to one of those shelters?
Absolutely. Transportation is, of course, always challenging. And if you're able to assist with that, that's always the best way. But making sure that if they don't have that, if there's another opportunity for them to go, because many communities do provide those services.
How much more proactive should we be during heat waves when we know they're coming?
When they're coming, make sure our groceries are stocked, we've got our medications, and also to make sure that someone's checking on us. It's, a little bit, it goes a long way that way.
Yeah, we talked about the elderly. Obviously, we need to be paying close attention to our young people as well. Maybe not as susceptible to some of those conditions, but certainly vulnerable, right?
Absolutely. Sometimes we become the, weekend warriors where we're just working out so much or don't think it's going to bother us. So there's always the opportunity to, one, protect our skin, make sure we stay hydrated, and water is your friend. We don't always need Gatorade or other waters with salt or other things in it. So, and of course, shade. Protect yourself during those times with hats also.
Absolutely, absolutely. Well, I really appreciate your insight on this. I mean, especially when you have the mentality, like my mom, we played outside all day, so that just kind of forces you to go outside even more. But, even shades, I understand that putting on shades also protects your eyes in the longer run, where we didn't have that when I was young at least. But doing that, is there any other thing that you can take necessary precautions to protect yourself, body as a whole?
Well, of course, there's sunscreen on your face and your ears, nose. And to your great point about shades, sunglasses, of course, because, sunlight and strong sunlight at times as we age and eventually lead to cataracts also. So that was a great point from you.
Yep.
Thank you for that again.
Been in weather for a long time, Dr. Sharma. You know how it goes. Thanks so much for joining us. Really appreciate your insight.
Thank you. You have a great day.